Assalamu alaikum. So in this video, we'll be covering the abducens nerve. This is video number 6 in a series of videos covering the neurosurgical anatomy, going through the Rhoton collection of the neurosurgical dissections. If you haven't watched the previous videos, make sure to go through them because a lot of those dissections are kind of repetitive. So it's very useful to go through the cranial nerves anatomy one by one. You can watch that through the playlist on the channel. So we will make a start here to look at the origin of the abducens nerve, and this is a view from the fourth ventricle, kind of a posterior view. So the abducens nerve basically arises from the abducens nucleus, as you know, which is located within the facial colliculus. The facial colliculus you can see if you go into the fourth ventricle from a posterior approach. Then the floor here of the fourth ventricle has been cleared up or dissected so that you can see the structures. Here the facial colliculus, as you can see, which is basically formed by the abducens nucleus and the intrapontine segment of the facial nerve. So that's the facial nerve as it kind of goes around the abducens nucleus. And that collection makes the facial colliculus. And the abducens nerve is just arising from the abducens nucleus. Then it travels anteriorly to exit through in the junction between the pons and medulla. Then if we look here at the brain stem, this is a previous dissection that we have seen before. You can see the abducens nerve, it emerges from the pontomedullary sulcus. And that's medial to the facial nerve, which also comes out of this sulcus. The abducens nerve entry zone is basically superior to the hypoglossal nerve. So you can see the hypoglossal nerve here. And then we have between the hypoglossal nerve and the rest of the lower cranial nerves, we have the olive, which is highlighted here in green. And that separates the hypoglossal, which is this one, from the other nerves, which we have the glossopharyngeal, we have the vagus, and the spinal accessory nerve. We have one nerve higher up here. If you can identify that, please let me know in the comments below. We have covered this in previous videos. Then let's look at the relationship with the vessels. So you can see that the abducens nerve here, and the vessel that will be in relationship with that will be the ICA, which is, you can see here, around the pontomedullary sulcus again. Then this is a very nice view where it shows the abducens nerve takes a vertical running pathway on the brainstem. So it's basically, as you can see here, travels vertically in that subarachnoid space, and then it pierces the dura. So the dura is kind of taken out here, and then it pierces the dura. So it's transition into an extradural segment. Similarly, again, this is kind of an endoscopic view, but a wider view. Here it's penetrating the dura in this picture. Then it travels through the Dorilus canal. And from the Dorilus canal, which we'll explain later on, it goes into the cavernous sinus, which highlighted now. Then the oculomotor nerve is seen here in the interpeduncular fossa. Here is a picture that we have seen before as well. You can see the abducens nerve here on one side. Here the dura is kind of removed, and again you can see the abducens nerve here. It's a small one, and it comes along in relationship with the inferior petrosal sinus. Then within that picture, again we have seen that picture before, but you can see the abducens nerve is all the way here down there. Then here we kind of removed part of the dura, and you can see the relationship with the petrosal sinus. So you can see that it's kind of penetrating or passing through the inferior petrosal sinus before it enters into the Dorilus canal. Then here we uncovered a bit so that we can see the entrance. So here the abducens nerve is going through the Dorilus canal, which is roofed by this ligament. This ligament is called the petrosphenoidal ligament, which is the Gruber's ligament, which is that one. And from its name, it's extending between the petrous and the sphenoid. Here, this is the cisternal segment of the abducens nerve. So you can see it as it's going. Here we have done an anterior petrosectomy, and they can see the nerve is kind of coursing vertically along the clivus here. and that's all medial to the trigeminal nerve and its branches. And if we look here, this picture showing duplicate abducens nerve as it goes through the inferior cavernous sinus, and the oculomotor nerve here is entering into the roof of the cavernous sinus. In this picture, you can see the abducens nerve again, and it's going below this petrosphenoidal ligament, as mentioned before. And it's going into the inferior portion of the cavernous sinus, where it's paired with V1, the ophthalmic nerve, the first branch of the trigeminal nerve. Here we will be talking about the relationship between the abducens and the ophthalmic nerve. So in this picture, you can see the ophthalmic nerve is highlighted here, but actually it's partially removed. So we removed part of it so that we can see the abducens nerve medial to it. So you can see here the abducens nerve, but you have to take this out so that we can see it. Then abducens nerve here highlighted. Again, the ophthalmic is cut out and going through the Dorilus canal, which is beneath this petrosphenoidal ligament, and traveling medial to the ophthalmic nerve. So that's the ophthalmic nerve. The angle between the abducens nerve and the trochlear nerve, which we have mentioned in the previous video as well, forms what's called the infratrochlear triangle, which is here. So infratrochlear, and we have the supratrochlear triangle. Then this is a medial view. We're looking at an endoscopic medial view. You can see the abducens nerve, which is going through the dura and traveling medial to the internal carotid artery into the cavernous sinus. Again, this is the medial view. You can see the abducens nerve within the cavernous sinus traveling lateral to the internal carotid artery. You can see also the oculomotor nerve superiorly and the maxillary nerve of the trigeminal, not in the below, and is not in the cavernous sinus. Then here we will see how this nerve, the abducens, will course and go into the superior orbital fissure. So the abducens nerve is seen here, ophthalmic nerve, then they go through together in the cavernous sinus, and then they enter into the orbit through the superior orbital fissure. In this picture that also we have seen before, but just highlighting the abducens nerve. So the abducens nerve going here through the Dorilus canal and the petrosphenoidal ligament, which is highlighted here, goes into the cavernous sinus and then goes into the orbit. Goes through into the orbit through what? Through the superior orbital fissure here. And within the orbit, the abducens nerve will be moving and basically supplying the lateral rectus muscle. I hope you enjoyed this journey going with the abducens nerve as it comes out of the brainstem all the way to its pathway to the orbit. If you like this video, please like, subscribe to our channel, and also follow us in other social media platforms. This basically helps us to grow and helps us to maintain regular recording of those educational videos and to produce more educational content. Stay tuned for the next one.